Okay, let's dive into this. We're looking at something really interesting today, where technology meets frontline healthcare, especially in places that are pretty tough to reach.
Right.
Think about those healthcare workers who are the absolute first point of contact for people in remote areas.
Yeah.
In rural India, this is often the ASA workers, just crucial.
Absolutely vital. These accredited social health activists, the ASHAs, they're really the bedrock of the system in many rural communities. They live there, they're trusted, they're that link between the community and, well, the more formal healthcare system.
They do so much health education, basic checks.
Everything, yeah. They're that essential bridge.
And we've talked before about how tech, like AI, is starting to help out healthcare pros. Things like decision support for paramedics before they even get to the hospital. So our mission for this deep dive is kind of similar, but really focused. How can AI specifically help these ASHA workers in rural India using, surprisingly, quite simple tools for early detection in emergencies?
And that need is definitely there. The big challenge for ASHA workers, as the sources point out, is that they operate so remotely.
Right, far from doctors, specialists.
Exactly. So when an emergency happens, they need to assess things quickly, accurately, and figure out, okay, what's the next step? Can this be managed at home? Do they need the primary health center? Or is this serious, like hospital level serious?
That's a huge amount of pressure making that call alone.
It really is. That quick, accurate decision-making is vital, but doing it without immediate expert backup, that's incredibly tough.
So this isn't about replacing them, is it? It sounds more like giving them a tool to help in those really high-stakes moments.
Precisely. It's about support. The sources talk about equipping ASHA workers with this simplified AI-powered triage tool.
Triage tool.
Okay. Yeah. Think of it like a smart assistant on their phone. Usually it's envisioned as a mobile app. And just for clarity, triage is basically sorting patients by how sick they are to figure out who needs care most urgently.
Got it. An app. So how would that actually play out? Let's say an ASH worker gets called to a home. Village is miles from the nearest clinic.
Yeah.
What happens?
So the idea is the app provides a kind of structured guide. It would prompt the ASH worker to collect key information, maybe check vital signs if possible, answer specific questions about symptoms, how the patient looks, key things the AI needs.
So it's not just random notes, it's targeted data collection.
Exactly. Targeted data points. Then the AI system behind the app takes all that information.
And does what with it?
Its main job is to process that data and generate a risk score for the patient.
A risk score?
Huh.
Okay, what does that tell the ASH worker?
It's basically indicating how severe the situation might be. And based on that score, plus the specific data points entered, the AI then suggests a course of action.
So that's the decision support piece.
That's it. The suggestions could be anything from, okay, manage this at home with this advice, to refer them to the local primary health center, or even, this looks critical, immediate transport to a hospital is needed. It's about providing that initial sorting, that pre-hospital triage support.
Okay, I can see how that connects to early detection. If someone's showing signs of something really serious, like, I don't know, a potential stroke or maybe a bad infection.
Exactly. In those cases where time is absolutely critical, this AI tool gives them a systematic way to assess the situation and offers a data-informed suggestion for what to do next.
Which could save crucial time.
Huge amounts of time. Getting the patient to the right level of care faster is key, and it directly tackles that challenge of distance. Ultimately, the hope is this kind of tech could really improve access to timely, quality care where it's often hardest to get.
Potential sounds massive. But,
yeah,
and there's always a but, right? Making this work on the ground in rural India, I imagine that gets pretty complicated. What are the hurdles?
Oh, definitely. Implementation is where you hit the big challenges. The tech might exist, but deploying it effectively, that's another story. A major one is just infrastructure.
Like internet.
Yeah, reliable internet. A mobile app often needs connectivity, and that can be really patchy, or just not there at all in many remote areas.
So the app itself, the system, it would need to work even when the signal is bad or non-existent.
Absolutely. It has to be designed for low bandwidth environments. That's critical. Then there's the incredible language diversity across India.
Right. It can't just be in English or Hindi.
No way. It needs to work in multiple local languages to be truly useful. And beyond the tech stuff, you've got practical things like, is it cost-effective to roll this out widely? Do the ASH workers have the digital literacy needed? Or maybe more importantly, will they get the training and ongoing support to actually use the tool and trust it?
Training and trust, yeah, that's huge for adoption.
It is. And then, of course, there's data privacy and security.
Mm.
You're collecting sensitive patient information, often in quite vulnerable settings. That needs extremely careful handling.
So it sounds like just building a cool app isn't nearly enough. You need a whole ecosystem around it.
Exactly right. Success hinges on really careful planning. It has to be tailored to the local context. You need strong collaboration, health departments, tech folks, trainers, and crucially, the ASHA workers themselves have to be involved from the start. It's about building something sustainable that fits into how things already work and genuinely supports the users.
Which kind of loops back to our starting point. This isn't AI taking over, it's AI augmenting human skills.
That's the core idea. It's about boosting the capabilities these dedicated health workers already have, giving them better tools, better information right there, right when they need to make those tough calls.
Empowering them, really.
Yes, empowering them. It's about making sure the benefits of, advanced digital tech can actually reach the grassroots, helping the people doing the essential work on the ground.
So if we step back, what's the big takeaway here? It seems like a relatively simple tool, this guided assessment app, could actually have a pretty profound impact for ASHA workers in emergencies.
I think the takeaway is that potential. The potential to spot life-threatening issues much earlier, to get patients to the right care more efficiently, to help bridge that geographical gap that can cost lives. It really shows how tech can be this sort of quiet partner.
A silent assistant.
Yeah, a silent assistant, providing guidance that could directly lead to saving lives by prompting timely action.
This whole deep dive into AI helping ASHA workers in rural India, it really drives home how powerful even simple tech can be. An app providing structured guidance, acting as a vital assistant for that crucial early detection and referral. It's about bringing smarts right down to the community level.
And what's really compelling, I think, is how this shows the future of healthcare intelligence isn't just in, fancy hospitals with cutting-edge equipment.
Right.
It's also happening right there, on the ground, in the hands of people like ASHA workers. So maybe something for you, the listener, to think about. What does it really mean when advanced tech starts empowering individuals already doing such essential frontline work, helping them potentially make faster, better decisions that could completely change the outcome for someone in a remote village? It's quite a powerful thought.